Hello, everybody. My name is David Boucher. I currently serve as Chief of Service Excellence at Aster DM Healthcare, based in Dubai, United Arab Emirates. I want to first thank all of my friends and colleagues at HealthCore for the opportunity to share with you today a few minutes, but more so for boldly taking this time to put together this type of program. I think this is essential for growing our professional backgrounds and everything else. So today we're going to talk a little bit about concepts and the framework for managing risk, right? And so areas, I'm going to spend a little bit of time, significant time today, talking about areas of risk exposure, about calculating levels of risk and prioritization as well. I'm going to talk a little bit about change management. So I tend to refer to the areas of risk management really is what I refer to as the three S's, right? So, and that is areas of patient safety, exposures in the area of patient service. And then third would be savings, or specifically in this case, financial risk exposure and everything else. And so as we think about it, we'll start with probably the most important. As most of us are aware, and we understand the Hippocratic Oath of first do no harm, patient safety really needs to be the number one, first and foremost area that we should be thinking about and considering and stuff. That's quite frankly the business that we're in, right? So at a high level, we look at areas of exposure to patient safety, and the immediate ones that come to mind are medication errors, are post-surgical site infections and surgical complications. Certainly patient falls from family members and guests and physicians and employees. And then, of course, tragically, potentially, is the area of fires. And so, I think it's critically important for us, and I'll just touch on each of these. On the clinical side, for medication errors, post-surgical site infections, other complications that take place, I think it's incredibly important for us to be honest and transparent in reporting. I can tell you that we know that in the United States, for instance, a significant percentage of medication errors go unreported, undocumented and unreported. And I think that if we knew what the actual numbers were, that we would have a more aggressive and more focused approach to actually improving the problem. So we tend to tell our associates at Aster and other organizations where I've worked, that it's important to be as honest as we possibly can in reporting, whether it's service or, in this particular case, safety issues. I think the areas of falls, whether it's a glass of water that's been spilled in a hallway, if we walk by it, we have the responsibility to stop ourselves and clean it. And if not, to certainly flag somebody down from housekeeping, hospitality, nursing, or wherever, just to make sure that it's been addressed. While we may have seen it, those pedestrians, people walking behind us may not see it, might slip and fall, break a knee, break a wrist, or whatever, or something more tragic than that. So really, really important for that. Same with fire safety as well. And I'll basically combine fire safety and security for a couple of reasons. For this purpose of this conversation and stuff, I've often and not often, I've regularly believed and espoused in the hospitals I served for as a hospital CEO in the United States for years, that things like safety and security are the responsibility of every employee, every volunteer, every physician. On and on. And that is, if we see any kind of exposure to security, it's everybody's responsibility to deal with it right then and there. Small things like having a rock or a piece of wood, a stick stuck in a door, holding it open. That can lead to a security. It can lead to the abduction of an infant. It can lead to of violence. And so, little things like that are everybody's responsibility. So it's a significant area for risk exposure. Same with fires. Fire safety is everybody's responsibility. If you see a problem or recognize a problem with a smoke detector, with a louver in an air vent that's going through a wall penetration. All of that, we need to deal with it because the lack thereof, quite frankly, can cause lives. Second area is patient service. And so, again, today, I think we would all agree that are in this meeting today would all agree that we live in an Insta culture. And that is that we push a button and we get Netflix, we push a button and Grab or Careem or Uber or some food service brings a Starbucks right to our office, right to our home, right to wherever we are. And so the expectation from a patient or consumer perspective is that we push a button and everything happens instantly. So everything from delays in visit appointments, delays in getting lab results, delays in insurance verification, all of that is all really, really important. They all affect patient service. So we believe that, quite frankly, mediocre or terrible service absolutely affects the bottom line of the hospital. It affects your top line revenues and unnecessarily increases your costs. That's an exposure to risk. The flip side is that excellent service can absolutely boost your bottom line, can grow your top line revenue. We know that the revenue, if we've got outstanding service, that the revenue per patient visit will go up, that our occupancy will go up, that our repeat customers, repeat patients will go up, both inpatient and outpatient. And that's all significant. So, we believe that patient service absolutely can drive the bottom line. So we need to pay attention to that. And I'm continually, to use a couple of cliches, I continually remind myself and others that it's not the big that eat the small, right? It's the fast that eat the slow. And that's actually the name of a book that was published 19 years ago, but it absolutely applies to what we do in healthcare and so many other different markets as well, but specifically to what we're talking about today. And that is that whether we are in the process of offering or opening urgent cares, whether we're providing now telemedicine services, which I think is key. And again, I know that our colleagues at HealthCore have launched a virtual hospital and telemedicine. I applaud them for that. I think that's spot on. Those are the types of things that HealthCore needs to be doing. So I think that's important as well. But I think, again, we need to be mindful. We need to be able to provide that level of service, ideally on a near time or very, real time, near time, or very, within really 3 or 4 hours from when it's requested. So that's really important as well. And the third area, again, that I would speak about is the whole area of risk exposure, is that of financial risk exposure, right? A lot of people don't think about this. Our professionals who work in risk management around healthcare absolutely think about this, right? So having, for instance, having poor accounts receivable, right? So taking 2, 3, 4, 5 months collecting dollars absolutely affects the bottom line. It affects our ability to be a going concern to actually provide services. If we're not paying our vendors, it's very difficult. It's not a reasonable expectation for them to be delivering, whether it's Baxter Travanol IV solutions, whether it's Stryker implants, whether it's Medtronic cardiac supplies. And so that's an exposure to risk as well that we need to be mindful of. And conversely, the whole area of fraudulent billing, whether it's over or under billing, both are very, very important for us to be sensitive to. They're all exposures to risk. Now, in the whole area of a touch on the issue of prioritization of risk management and risk mitigation, if you will. Sometimes it's very, very, I found most times it's actually difficult to basically sequentially plan how we're going to mitigate risk on various issues, right? So many times we have significant risk exposures that we really have to deal with on parallel tracks. And so we need to be sensitive to that we may have something going on in finance. We may have a material risk exposure in our whole patient registration area. We may have a significant exposure to risk in supply chain management. That's an area of risk, especially today in the area of COVID, in which we've all boldly operated. And so so many times we have to look at the resources that we have available to us, whether they're human resource or financially, if we can engage consultants to help us on some of these things. But many times things can't get done one at a time. We really need to be working on these issues on parallel tracks. So that's really important as well. And the final thing that I would touch on today, again, is the whole area of change management, if you will. And again, I've worked in healthcare now for 43 years of my life, and it's been a very interesting career. But almost every year or two, I hear, well, this is going to be the most challenging time in healthcare that we've ever seen. I've heard that phrase probably 43 out of 43 years that I've been involved in this field. And some people like change, some people don't. I happen to enjoy change very much. Change has been one of the really only constant things in my entire life. And I'm blessed to have actually worked at hospitals one way or another in 39 countries so far. And so I've worked with hospital staffs, with hospital boards, and providing feedback and things. But truly, we need to embrace change. And given the situation with the worldwide pandemic with COVID-19, we have had to exhibit adaptability like never before. Truly, this has been, if we think about it, we read stories, we saw stories about running out of ventilators, about running out of oxygen. Never in my life that I would ever hear the concept. It's surreal, right? That we've got people dying in ambulances at hospital loading docks because we are not able to produce oxygen and things like that. And again, I don't know so much about the Philippines. I know this was a real issue in India in the past, not today. So I think that these are very, very difficult times, and certainly people that work, the heroes truly that work across all of our healthcare verticals, hospital, that from the caregivers, have really illustrated, really have lived out true heroism repeatedly, day after day after day. I know I was living in Thailand, and Thailand was the first country outside of China to actually have a positive case of COVID-19, going back to I think January 12th of 2020, and I was in Bangkok through August of last year, and so I've been living in this like many of you, I'm sure, really for going on. It seems like knocking on 2 full years with this, and so it's really tested our mettle, if you will. It's really but again, I continue to remind myself and other professionals that I have the privilege of working around, is that as health professionals, as public health professionals, we chose this career, and we don't shy away from issues like pandemics. Quite frankly, we run towards them, and that goes with the territory. And again, bravo to each and every one of you for participating in these sessions and to really trying to improve your careers and your knowledge base and skill set and everything else. I'll also leave it there and thank my colleagues from HealthCore. Again, I'm humbled to have this opportunity to share some random thoughts on this whole area of risk management, managing risk, and change management. So with that, allow me to say salamat po. Thank you very much. Have a great day. And if there's any questions or comments or whatever, I'm sure my colleagues at HealthCore will pass along my contact information, and I'd be more than honored to circle back with you and have a conversation. So thank you very much.